Hi, nice to meet you. My name is Dr. Nava, and we're here to talk about Tanya and the present and future of her burns. To start off, the integument is made up of three major layers: the epidermis, the dermis, and the subcutaneous. The epidermis is composed of keratinized, stratified, and squamous epithelium. It provides a thick, waterproof protective covering over the underlying layers of the skin. The dermis is composed primarily of dense, irregular, fibrous connective tissue that is rich in collagen and elastin. The dermis contains blood vessels, nerve endings, and epidermally derived cutaneous organs such as sweat glands, subcutaneous glands, and hair follicles. The subcutaneous layer is composed primarily of loose areolar connective tissue and adipose tissue. The fat layer provides mechanical cushioning and a thermal insulation for underlying organs. The overall function of the skin is that it prevents us from desiccation or drying out. It protects us from bacterial invaders along with mechanical, chemical, UV, and thermal damage. It helps in temperature regulation, aids in excretion of urea and uric acid, synthesizes vitamin D, and helps us sense touch, pressure, temperature, and pain. Since your daughter is suffering from second and third degree burns on her hands, legs, abdomen, and other limbs, we'll have to quickly give her the treatment plan that I prepared for her. So immediately after Tanya is brought into the pediatric unit, we will give her IV fluids until her vitals stabilize and keep her until transfer to the burn unit is possible. At this stage in time, we will also be introducing her to the broad spectrum antibiotic. In case you were wondering, the broad spectrum antibiotic is a medication given to treat and or prevent infections from a wide variety of bacteria. Since Tanya's third degree burns place her at considerable risk for infection because she no longer has a protective covering against bacterial invasion. The skin is normally colonized with bacteria, in case you were wondering too. On intact, these bacteria cause no threat and may in fact protect us from more dangerous microorganisms. In damaged skin, however, these normally harmless bacteria can cause severe blood-borne infections. For this reason, broad-spectrum antibiotics are given both topically over the skin and by injection. So after 24 hours, the debridement of burns will begin along with application of the broad-spectrum and the topical antibiotics. Plastic epidermal gas will be applied over burned areas. This is because the skin that is severely damaged by the third degree burns often requires weeks or months to heal, were it not for the development of skin grafts, which helps speed the healing process. Also, I recommend social work and the therapist to visit Tanya twice a day for the first few days to help her process the events that happened. After 1 week, Tanya will regularly change her bed position every 2 hours to help prevent the possibility of ulcers. She will be given nasogastric tube feeding of 5,000 calories per day, since her body is undergoing a major inflammatory and healing process, which requires a substantial calorie intake to provide the energy necessary for this response. After 9 weeks, the gap sheets of cultured epidermal cells will be added to her regenerating dermal layer. Finally, after 15 weeks, Tanya's epidermal gap will be complete and she'll be back to solid foods. Her antibiotics will be discontinued and she should be discharged from the hospital. A rehabilitation plan for both physical and occupational therapy at home will be made, along with a twice-a-week visit by a nurse and a weekly visit by a social worker and psychologist. I really thank you for meeting with me, and I believe it's best for you to be by your daughter's side right now.